guys, it's Dr. Uyawane from the Dr. Uyawane from the Dr. U Show. Welcome to the Dr. U Show. My name is Dr. Uyawane. Hello guys, welcome to the Dr. U Show. My name is Dr. Uyawane and I'm a medical doctor with a specialty in psychiatry. Today we will be talking about how to address your other medical issues during this pandemic. Now when I say other medical issues, I mean non-coronavirus illnesses. So you may have medical in terms of physical, somatic health problems like diabetes, asthma, high blood pressure, migraines, or you may have behavioral health issues, so more like mental health problems or emotional problems, depression, bipolar, any kind of psychosis or substance use. Now, these issues will not go away just because the pandemic is happening. And so if you have an acute exacerbation, if something comes up, how can you get it addressed, especially in light of the hospitals being filled with many of the COVID-19 patients? So some things you can think about just ahead of time is you want to stay healthy. So practice healthy habits because you want to not need medical services at this time. Many of the doctors and the nurses are addressing a lot of the COVID-19 patients and their illnesses. So you also don't really want to expose yourself being in those settings. So do what you can to be healthy. Rest, eat healthy, try and get a balanced diet, exercise when you can. Another thing you can think about is plan ahead. So if, for example, you notice you're beginning to run low on your medications, call ahead of time to your doctor's office, ask them for refills. Now, when you call, let's say for a refill, ask them for a slightly longer time, ask them for a 90-day supply. Or if you get a prescription, ask if they can give you multiple refills. That way you don't have to keep going back to them every month to get refills. And that way you can push out how long you have to see them, okay? Now, another option is, let's say, for example, you really do have something that comes up that needs to be addressed. One option that has come up now and is pretty popular is telemedicine. Now, if you haven't heard of it, it is getting medical services through virtual technologies. And so when I say virtual, I mean online. So this is through your computer, through your phones. In essence, you can get a whole clinical appointment right from your home remotely and do this on your computer. So let's say, for example, you needed to get seen fairly quickly. You can call your doctor's office, ask them if they have this service, if they offer telemedicine or telehealth services. Many clinics right now are transitioning to this kind of care because of the pandemic. So they may have this option. If they do not, and you really need to be seen fairly quickly, you can reach out to one of the local urgent care clinics in your area. Again, many of those clinics are offering these services, and so they might be able to see you rather quickly. Another option, again, is to reach out to your insurance company. Now, this might be a good idea to do anyways, because you want to know if they cover this service. And when I say insurance, I mean medical insurance. You want to find out if you get coverage. And if you don't, ask for other options. Ask if you can do a telephone session with your doctor. And this way you can still get seen, it may be by telephone, but at least your issue gets addressed. And then finally, if you're still not able to get in with somebody, you can actually go directly to many of the telemedicine platforms. You see up on the screen, I have just a link. This is a colleague of mine who has a clinic that provides this service. This, for example, you could go directly and make an appointment to see a clinician like this. She's a nurse practitioner, she's great. And so you can even find somebody in your area, somebody who you can get in to see rather quickly. This way you get your needs addressed. I hope this was helpful. Thanks for watching. Like it if this was useful, share it, and subscribe. Till next time.